Now, procedures in this seminar are based on a paper that I wrote called AK Assessment and Treatment of Inflammation in the Brain, the so-called brain on fire syndrome. And that's part of the notes that you have. This was presented by me at the ICAK Canada meeting, which was the international ICAK meeting in September 2012, and then again at the ICAK USA annual summer meeting in Los Angeles in 2013. This paper, I'm just going to read to you a little bit from the conclusion of this paper. Manual muscle testing provides a real-time somatic window on neurological and neurochemical function that allows the clinician to penetrate the uniqueness of each person's brain function. Imbalances in nutrition create or aggravate problems with neurotransmitters and inflammatory mediators, which is the focus of this weekend. Each imbalance summates with other imbalances and is aggravated by excess or deficient sensory activity from muscles and joints, visceral dysfunction, and other cortical functions. Manual muscle testing assesses for the most appropriate therapy or therapies for each patient on each office visit in a manner that is unparalleled in the healing arts. We can be precise about identifying what's wrong with our patients' brains and what needs to be done for our patients' brains. And it changes. It's like taking an x-ray. You take an x-ray on a patient and you adjust them and you know they're different the next time, but you don't take another x-ray on the patient. You treat them based on what you find clinically. And you may down the road take an x-ray on a patient, but to follow up, but it's like lab tests. You don't do a lab test on a patient every time they come in. How are you going to know how the patient's changing each time they come in? Well, for spinal things, those of us who are chiropractors, we have our different assessment procedures. We have AK procedures. You don't necessarily have to do the same thing every time the patient comes in because we know they change from the result of one treatment to the next. Same thing's true with the body chemistry. When we treat in the fashion I'm going to show you, things change. And how do you keep up with those changes? So, I mean, I know some people, and they're good doctors, they're intelligent doctors, they're functional medicine doctors who really know their stuff, and they'll do lab tests on a patient, they'll put them on a program, and they'll put on that program for 3 months or 6 months or maybe forever and say, this is what's going to help you. And then sometimes it does, and then sometimes it doesn't. Or it helps a little bit and stops working because the patient changes. How do you keep up with the real-time changes? What we're going to show you this weekend is how to do it. It's fascinating to watch how the brain works and how the body chemistry changes with time as you treat the patient structurally, chemically, and mentally.